A new study indicates coronavirus symptoms felt in the first week of infection may be a predictor of just how long they will last. According to research published in the peer-reviewed journal Nature Medicine, patients who felt more than 5 symptoms in the first week were more likely to become what's known as COVID long haulers. Those symptoms include fatigue, headache, hoarse voice, muscle pain, and difficulty breathing. Researchers qualify someone as a long hauler as having symptoms for longer than 28 days. So Ann Wallace detailed her experience suffering from COVID-19 for almost a year in a recent Huffington Post article. She's an associate professor of English at New Jersey City University, and she is joining us now. I'm really, really glad that we are talking to you. I was listening in on a conversation with a number of doctors, and many of them had said that we are not talking enough about long haulers. There's not enough research into it, and this is the continuation of the pandemic, and it should not be ignored. So I want to ask you about your experience. You know, when did you first get sick? And what have your symptoms been like? What were they like when you, in the sort of the crucial first few weeks, and what have they been like since?
Sure. Well, first of all, thank you for having me here. I really appreciate it. I fell ill in March of last year. It's been just about 1 year now for me. And in that first, my acute stage of illness lasted about 2 months. I was very sick for an extended amount of time in that first phase. It started with chest pressure, chest pain, a searing pain in my chest, as if it was on fire inside of me. A lot of hypoxia. I had a very hard time maintaining my oxygen levels. So if I needed to be on strict bed rest, basically. I didn't have the ability to be on my feet. If I didn't have the energy. And also I couldn't maintain my oxygen levels if I stood up for more than a few minutes. So it was the crushing fatigue I had, insomnia and migraines, it just an array of symptoms that didn't stop. And now, a year later, I still have many of those symptoms. The chest pain has abated greatly. I do not have that searing pain anymore in my chest, but I have other symptoms that have emerged over time, and they seem to cycle through. For a lot of long haulers, we have phases where we have one symptom and it goes away a little bit, calms down, and then another one emerges. And I have joint pain and shoulder pain in my muscles and joints. It's been escalating for months now. So it moves. It's different every day, and the symptoms keep cycling through me.
So, Professor, you've recently received your first dose of the coronavirus vaccine, and some COVID long haulers have reported improvements in their symptoms since becoming vaccinated. Have you noticed a change in your symptoms at all?
I have not yet, so I haven't had my second dose. I'm hopeful that one might be the golden ticket. Regardless, the vaccine is crucial, right? Everybody should get vaccinated. So I'm glad to have had my first dose. I did have an escalation of my symptoms in the first week or so after that, but that's calmed back down to my baseline of long haul symptoms. Maybe after the second one, things will improve. For a lot of people, that has been the case. So I'm hopeful.
You know, in talking to other long haulers and talking about it, it occurs to me, and I've said this before, that it sort of reminds me of some people who suffer from various autoimmune diseases, whether it's fibromyalgia or chronic fatigue syndrome. They're these kind of illnesses that there isn't a test for. So it's hard to sort of confirm that you have it. And with COVID, there's a test. You take the test, you get, you get the scrape up your nose or whatever, it says you have it or you don't have it, and if you don't, then you should be in the clear. I'm wondering what this journey has been like for you in terms of the doctors that you've dealt with. Was it difficult to convince people, no, you're still sick, even though the test says otherwise?
Well, first of all, I want to say I was incredibly lucky to even qualify for a test back in March. A lot of long haulers were never tested because tests were in short supply. My own daughter she tested negative because she was tested too late. We were tested at the same time, but I became infected from her. So by the time we got tested, the viral load had already cleared out of her system, even though she was still very sick. So she's a negative. She doesn't go in our case counts, right? There are lots of people like that who don't have a confirmed case. Now, also, so that's one thing that long haulers face, that many of the people ill from last March, it's very hard for them to convince their doctors because they don't have that test result. I'm fortunate. I do have that test result. And I'm also fortunate because my doctors have been incredibly supportive. They've been watching me from before I got the test. They insisted I get the test. They made me, they encouraged me to go out of my way to track down a test at a time when it was so difficult to find one. And they didn't have them themselves, so they couldn't test me. It wasn't that they were unwilling. They didn't have tests in my primary care doctor's office. It is difficult for a lot of people, even with as fortunate as I've been with my doctors believing me. I've also seen doctors who don't believe that my symptoms are COVID related. And yet we have the evidence. A lot of long haulers have been putting in the research, doing the studies, because the medical community, well, they've been strapped. They've been trying to keep people alive. So I understand their priorities. They've been developing a vaccine. This is a full-on onslaught, right, that we've been facing. So long haulers have been doing a lot of this research themselves, and it's been vitally important, and it's now being recognized by the medical community, thank goodness. And so we are seeing progress now. A lot of doctors are recognizing that people didn't get the test result right away, and yet they can be considered a presumed positive case, to have had the presumed positive case. And we're also being recognized now, finally, by many doctors and by the NIH, et cetera, the CDC, that these long haul symptoms do last a year or longer. And that's also crucial. And they're putting in the money for the studies now that we need. So I am optimistic for the future, but in the meantime, we do feel like we're very much in limbo. And on the individual level, our families often don't believe us, our employers don't believe us, our friends, our doctors. It's a push, and it's demoralizing, and it's exhausting to have to tell your story again and again and again, in the hopes that somebody will believe you.
So in a piece that you wrote for the Huffington Post, which we referenced, you say prolonged illness is not new territory for you. Having survived ovarian cancer and living with multiple sclerosis for the past decade. So how has living with COVID for the past year been different from these other illnesses you've experienced? And I'm so sorry that you're dealing with that. I can only imagine how scary it must be, given that we know people with pre-existing conditions have succumbed to this infection. Yes,
it has been. It was absolutely very scary in the beginning, and it was one of the reasons why my doctors were so, my primary care doctor was so insistent on me getting tested, and had a caseworker call me every day, for instance, because I do have a pre-existing condition, and I know they were very worried for me. So, but this has been quite different than having ovarian, like, for instance, ovarian cancer. I had it in my 20s. It's a deadly disease. More at the time, people died and survived. I was very lucky to have had a fantastic doctor and some good luck on my side. So I survived. But the difference for me from that, for instance, is that my doctor was a trained gynecological oncologist. She had years of training dealing with ovarian cancer. She knew what to do. It was not a new disease. As deadly as it was, she had strategies. She had a plan A and a plan B for me of what to do. I had surgery, I had chemo. If the chemo didn't work, she had another regimen of chemo she was going to put me on. And I had that, and it was successful, and it was over. COVID is completely different from that for me. Thankfully, my cancer story was finite in that way. MS, there is no cure for it, but those symptoms are, my MS is very much under control. Before I had COVID, I was running. I put a picture in, I asked them to include a picture of me skiing a couple weeks before I became sick, because I wanted people to see that, yes, I was an active person. I worked more than full time. I had many things on my plate, and I was able to manage all of them. I'm a high energy kind of person, and despite my MS. So having a pre-existing condition certainly put me at higher risk, but it didn't mean that I was debilitated before I became sick. I am debilitated now, and that's different for me. I don't, it's hard because we don't know what the end is here. Every time I think I'm getting better, the goalpost moves further down the field. Where does that end? I don't know. I do think it will end, but I don't know when and how.
You know, when you were just mentioning just how experienced your gynecological oncologist was, I was thinking to myself, and there's no equal when it comes to the coronavirus, because it's a new virus. There's no one that has decades of experience handling this. And so now we see, you know, people are getting vaccinated, and almost kind of in the last couple of weeks, we've seen a number of states easing their coronavirus restrictions. Of course, Texas, you know, lifting the mask mandate, saying that it's okay for full occupancy. They're going to have a stadium filled with people there. I'm just wondering, you know, what your take is on that when you see people kind of, you know, throwing that mask off and whip it into the air, thinking that it's time to get back to normal.
It gives me great pause, and I find it extremely troublesome. The vaccine, I am so glad we have it. It is going to be a game changer, but you don't throw off your protective gear in the fourth quarter, right? Just because you're winning or it's tied or you're catching up, right? That's where we are. You don't walk off the field in the fourth quarter. You wait until it is safe, and we are not there yet. You know, I know 33 million people have gotten the full vaccination. That's 10% of our US population. 10%. It's fantastic, but we're not there yet. Masks matter. We also don't know the full extent that this protection that the vaccination offers us yet. It's brand new. Let's just take our time and make sure that we are safe before we start throwing our masks off, as you said. We need a little time to know exactly how protected we are, and we need more time for more people to be protected. The vaccine, again, game changer, but we're not there yet. So I just wish people would be a little bit more patient. You don't want to have long haul COVID. You don't want to have COVID, period. And we know that 1,500 people died yesterday in the United States from it. Still, we're not out of the woods.
Ann Wallace, thank you for sharing your story with us. We really appreciate it.
Thank you so much. I appreciate it.